Hi, I'm Israel McCall, and I'm doing my informative speech on what is a CRNA, a certified registered nurse anesthetist. Do you have a love for helping people? Do you have a passion for science and using critical thinking in order to help people? If so, maybe you should consider a career as a certified registered nurse anesthetist. Now, you may be asking yourself, what is a certified registered nurse anesthetist or CRNA? CRNAs are pioneers in the world of anesthesia who, like all nurses, care about their patients and provide a career essential to the healthcare system. Myself, I've worked in dialysis for 8 years, but I've also worked in ICU, ER, telemedical, surgical, and PACU. All of those experiences gave me firsthand views and experience to see how important CRNAs or nurse anesthetists are in the healthcare field and how well uh, they transfer their knowledge to help patients, especially in emergency situations. Today, I would like to inform you on what a CRNA is, what a certified registered nurse anesthetist is. I would also like to discuss why CRNAs are important and an intricate asset to the medical field. I'd also like to educate you on the process of becoming a nurse anesthetist. Some of you may have experienced in life a form of anesthesia. Maybe a family member that's gone to the doctor, or a family member yourself going through surgery, maybe a dentist's office, getting a deep cleaning, getting a tooth pulled or extracted, or maybe some of you women or ladies out there or men have experienced pregnancy and going through labor. All of those things entail some form of anesthesia. And you may have been asking yourselves, who's putting me to sleep during these procedures? Well, that person would be your CRNA or your nurse anesthetist. A CRNA is a registered nurse who specializes in administering anesthesia in every aspect, every setting, and for every type of surgery or procedure. The responsibilities entails for the CRNA to make sure the patient isn't feeling any type of pain or sensation during the procedure. CRNAs, certified registered nurse anesthetists, work in different type of settings, surgery centers, labor and delivery, plastic surgery, um, public health clinics, militaries, and hospitals. The basic duties of a CRNA is to conduct the patient assessment, to monitor the patient during the procedure, to administer anesthesia properly, and to also manage the post anesthesia for each patient. Now, with all of these details, you now know what a CRNA is and what a CRNA does and what the importance of a CRNA is. Nurse anesthesists have been providing anesthesia in the U.S. for 150 years, according to the AANA, which is the American Association of Nurse Anesthetists. Nurse anesthetists are the oldest nursing specialty group in the U.S. Established in the 1800s, but it was considered a certified profession in 1959. The reason why nurse anesthetists were put in use is because there was a high mortality rate during procedures. And doctors and professionals and higher ups looked to the nurses for help in order to maintain safety during procedures and maintain quality of life during procedures. Reports conducted by the Institute of Medicine in 1999 assets assets that times um, 50 times safer anesthesia was administered from the time nurse anesthetists began up until the 90s. And in today's time, that 34 million anesthetics are administered a year, according to the AANA. Anesthesia is used primarily in hospitals, um, and they provide over half of all hospitals with anesthesia in the United States. They are also the sole provider in 70% of hospitals and in inner city clinics. So you ask yourself, why would you want to be a CRNA? Well, here's why. First of all, the CRNA field is very rewarding. According to an article in the U.S. News and World Report of the 100 best jobs, nurse anesthetists ranked number 4. Um, they also ranked number 3 for best healthcare jobs and also ranked number 10 for best paying jobs. According to a 20-year veteran in the anesthesia field, from a blog on the CRNA All Nurses website, he says that in his 20 years, this is the most satisfied he's ever been in a career field, and this being his second career. In addition to this being a very personable field and personal satisfaction and extreme and excellent pay, nurse anesthetists offer supreme job security. According to the AANA, who represents 92% of the 36,000 CRNAs nationwide, they administer approximately 27 million anesthetics in the U.S. each year. That's good job security right there. CRNAs are compensated very well for their skills. According to the salary.com, CRNA's medium salary with just 5 to 6 years experience range from 168,000 to 177,000 per year. However, in some locations with more experience, it ranges over $200,000 a year. However, nothing worth having comes easy. So, with that being said, the road to becoming a nurse anesthetist is a bit grueling. First of all, you have to have a BSN in nursing. Second of all, with having that BSN in nursing, then your next step would be to have at least 1 year of critical care, whether it be ER, ICU experience, and then you get your master's of nursing in the healthcare field, which in turn you apply to a CRNA program, and then you actually have to pass an NCLEX and get your certification. Um, there are 5 lucrative schools, um, top 5 schools, which are the best schools, which is Virginia Commonwealth University, Rush University, Pittsburgh University, Baylor School of Medicine, and the U.S. Army rated number 1 as the best school and the best program for CRNAs. Um, you also have to work clinical hours and get your exam re recertify your exam every 2 years. With that being said, there are a lot of jobs in the medical field to choose from as a CRNA. So far, I've explained to you the jobs the type of settings you could work in, and now you know specifically what a CRNA is. Why is it important for them for them to be in the healthcare field? I've also illustrated benefits and steps to become a CRNA. So why not take the advantage to use your critical thinking skills in the fastest growing field and to become a CRNA like myself?